So Kimberly Perkins is the CEO of the Little Fork Medical Community, and she just finished her dissertation, which is very interesting. She was looking at the quality of care provided in urban versus rural centers, and she said, through her slides advice, she was able to demonstrate that actually the quality of nursing care is better in rural communities than it is in urban communities, which she attributed to
higher staffing levels, and nurses actually wanted to spend time with the residents rather than just a resident being a number.
So I'll let Kimberly speak.
I'm going to take the non-WOM.
There you go, the non-WOM.
Thank you very much. My name is Kimberly Perkins. I hold a Doctor of Health Administration, so I tell people I'm Dr. Kimberly Perkins, but not a real doctor of sorts. I don't practice medicine, but I supervise those that do. My scope is a subject matter expert on healthcare administration, both at the local level for organizations, as well as from a national, state level, and even global perspective. For those of you who have ever heard me speak before, I go off on a tangent, and I see we've been here almost an hour. I could take 5 minutes, I could take 2 hours, so Jim will, when it's time for me to shut up.
Like I did so good at that myself.
The 3 things I wanted to talk to you with tonight are about rural healthcare in general, constraints, which are going to affect us here in International Falls with our healthcare services, opportunities for rural health clinics, rural health organizations, and then finally, how do organizations remain independent, which is a very difficult feat nowadays with the way regulations and financing and reimbursement are streaming down. So, and I might not get through all this, so I don't know what, we'll figure this out. So some constraints. You had mentioned we have an aging population. Within just a few years, we're going to have more people, the population segment, age 65 and older than we are going to have K through 12 in Minnesota. That is very, very scary. Not because we don't like grandma and grandpa, but because who are going to take care of these seniors? We have a few nursing homes in the area. We have screen beds. I'm in Little Fork, so we have a nursing home, but there's not going to be enough room. So something to consider is what can our healthcare organization provide for our seniors, especially as they're aging and their population is going to be doubling. Who's going to pay for it? Statistics now show that seniors are not saving and have enough money when they retire or are ready for healthcare. And the reason is their children and grandchildren are unemployed. So what we're seeing is, my daughter-in-law is unemployed and the husband's not working, so they come to live with me and I can help them out a little bit. Well, the next thing you know, they need nursing care services in their journey because they're helping out their loved ones. I'm sure the county sees it, we see it, and it's going to be a trend that continues. So, something to keep in mind, what could our healthcare organization do to provide that? We are seeing a provider shortage as our population ages. Something that we all desire is to remain in our home. I know I don't want to live in a hospital, no offense, or live in a nursing home unless I absolutely have to, so we're going to start seeing more seniors wanting to stay home, albeit sometimes to their demise, because it's not always safe. Again, trend of less saving to pay for long-term care. Funding. We are going to see a huge jump in the number of Medicaid. Does everyone know what Medicaid is compared to Medicare? And it's okay if you don't. Does anyone not know? Okay, great. Someone doesn't know, so I have a job to do that. Okay, Medicare is ideally for individuals age 65 and older. It's a federal level insurance program. Medicaid was originally created for those that were indigent or severe chronic illnesses like end-stage renal disease. With the Obamacare, the state of Minnesota has elected to expand Medicaid services to, I want to say it's up to 130% of the poverty level. And taxpayer dollars pays for Medicaid. If we're going to start seeing more and more people on Medicaid in the state, that means more taxpayers have to fit that bill starting in 2016. For 2 years it's free because the federal government gave us a grant. But after that, we promised the federal government, hey, we're going to figure out how to make this financially viable. We're going to start seeing a lot more seniors qualifying for Medicaid and not as many taxpayers to pay for it. So, from a local standpoint, we need to figure out What services do we want seniors to have? Do we really think all 65-year-olds that limp need hip surgery? And that is a topic of controversy. Has anyone here ever heard of Dr. Ezekiel Emanuel? Well, you heard of it because I told you about it. Has anyone here heard of Ron Emanuel, the mayor from, okay. Ezekiel Emanuel is a physician. He works with our current federal administration in the White House. He is the medical director guru, if you will. And he saw this concern regarding our population that is aging. He's written numerous articles. This is just one. And I'll leave it here if anyone wants to read it. And his topic is Principles of Allocation of Scarce Medical Interventions. So here we have 65 and older is going to be 88 million. So doubling within 20 years. We don't have my age folks around to pay for them or doctors to be able to provide care for them. What do we do? So he had a great idea. Okay? If you are between the ages of 15 and 40, you count for something. Why? Because you're older than an 8-year-old, because you've been trained on your culture and your foundational beliefs. And you're not older than 40 because apparently once you hit 40, you're no good. And in this article, he bases medical intervention on what you can, as a human, give back to society. The concept is QALY, Q-A-L-Y, Quality Adjusted Life Years. So if you're 65 years old and you need a knee surgery, but there's someone who's 40, that 40-year-old is going to get it first. Is that fair?
Yes.
Why? And this is not my opinion. This is reality. We don't have enough doctors. We have a population that is doubling. And this is stuff we need to be aware of, and what could we do to start thinking about it now before it turns into grandma can't get surgery and she has to die at home. Do you want to, I know you want to comment, Cynthia.
Well, you're going to have to we do ration health care now. And I do think you have to consider that, and I think you have to consider that younger people's needs have a greater value.
And that is the quality adjusted life years. It comes down to the value. And I am just sharing this with you as fact. I don't have an opinion on it per se. Most people have not heard of this concept. So I'm just here as the messenger, if you will. There's also other ways of rationing healthcare that he goes over that just happens to be probably the most controversial. One is the lottery. Literally, you draw a name out of a hat. Who would get the surgery? And it had nothing to do with age. One of them was who treats their body the best. So it's not necessarily based on age. It's, you're fat. You eat too many Twinkies. You're not going to get the surgery. We're going to go with this person who's never had an eating disorder. So, there's pros and cons to each. But I'm here just to make these concepts aware so that way when we start to see changes in healthcare, you know what to look for. You know what to start questioning. And my theory is question everything until you find the facts. Any questions about that so far? That's just one little component of it. Sequestration. Is everyone familiar that the sequestration, I know Sue has, starting April 1st, fee-for-service Medicare, the federal level. So if you, I don't know who you are, but I'm going to pick on you, I'm sorry. If you go to the hospital, Duluth, you had knee surgery, and then you need to get care for therapy. Your options are swing bed at the hospital if you're allowed, or you can come to a nursing home, a Little Fork nursing home to get physical therapy. That's covered for the first 20 days by Medicare 100%. After that, Medicare pays 80%, your secondary pays 20% for up to 100 days. With sequestration, 2% of that is cut, and that starts April 1st with every claim submitted. The hospital is going to see that with Medicare B with orthotics and any type of supplies. Nursing homes are going to experience that. Well, the hospital will experience that with Medicare A with your physical, occupational, and speech. That's huge. Medicare A is one of the largest funders to healthcare in Minnesota, including rural health. So now that that's being taken away, you might want to ask the hospital or Rainy Lake Medical Center, what are we going to do to start offsetting that cost? Are we going to add more services? Are we going to cut staff? There's a journal article here that, where is it? The American Hospital Association stated that Medicare cut will kill 496,000 jobs including those of 92,984 hospital employees by the end of this year, and rural is not excluded. So the sequestration is a really huge deal. And it's not just in healthcare, it's in all different areas, but I'm greedy and I'm concerned about healthcare. So that's what I'm going to preach about. Yes, ma'am?
Why is that not passed along? I'm a little confused as to why this Medicare is not passed along to the Part B.
It has cut to Part B as well. So,
I mean, your Medigap or whatever, your supplemental policy would pick that up, correct? If you had one.
if you have, I believe,
Why is the hospital being affected is why I was asking the question.
if they're fee-for-service Medicare A or Medicare B, which they are, they lose 2% off the top from what Medicare would have reimbursed. If it's your insurance or Medigap, that's obviously a little bit different.
That's what I'm saying. If they're going to get their money, it's not going to be a loss to the hospital. I mean, they're going to charge it to the, whoever's having the service done.
No.
No.
They're not?
No.
The 2%, the supplemental pays what the...
Medicare allows.
Right,
Yes.
and if Medicare cuts it, then the...
So Medicare is allowing 2% less.
Yes, and the reason for that,
That makes more sense to me. Thank you.
the reason for that, it's supposed to save $10.7 billion fiscal year 2013. Again, that's an estimate. That's a lot of money. So we're seeing a loss now with healthcare organizations, because before the sequestration was allowed to go through, it's going to get worse. And I think that's just fair for everyone to be aware of. I'm sure you hear those old things on TV. Well, if you think you got a cough, call your doctor. Watch the TVs. You're going to start seeing those commercials slowly disappear. Why? Because healthcare is expensive. Pharmaceuticals don't want you to go see the doctor anymore because it costs too much money. We have a deficit in healthcare. So what was once easy to say, well, Cynthia, you have a cough, go make an appointment with your doctor. We're going to start seeing more self-serve. Has anyone here ever Googled why they have maybe a sore throat? Yeah. We're going to start seeing more of that. I'm not advocating for it because there's been some problems with that as well, but we're going to start seeing an increase in that. So remember, if you want the healthcare services to remain here, you need to go see them. Not just 1.3 times a year, but for more things for preventative health and wellness. What I was talking about was a result of the Budget Control Act of 2011. Has anyone in here ever heard of IPAB? It's the Independent Payment Advisory Board. You have, and I know you have after I talked with you. It was once called the Medicare Payment Advisory Board. Under the new Affordable Care Act, they renamed it IPAB. It's very similar to Ireland's NICE, N-I-C-E, which stands for, I don't remember now, some type of systematic excellence with insurance. What it is a group of 15 people that are chosen by our current administration, and their entire job is to figure out a way to reduce Medicare spending. Remember, Medicare is for 65 and older, senior population. What's happening to our senior population, guys? It's going up. So we have a super committee of 15 people to say, all right, our population is doubling, but we want you to figure out a way to cut costs in half. I'm not a scientist or a mathematician. I don't think that's possible. But we actually have a super committee now that's working on that to be able to cut those costs. And that's where the quality adjusted life years came from Dr. Emanuel. And that comes into play with it. That's one way to cut costs. There are some countries where you have to follow strict guidelines in order to get surgeries. I want to say it's the United Kingdom. I believe it's the UK where a woman is only allowed to get a pap smear if the doctor truthfully believes that the individual has cancer, because it costs a lot of money. Again, just something for you to be made aware of. Staffing, we talked a little bit about constraints with staffing. I know she has. It was brought up before. In general, there is a shortage of qualified staffing, and how do we attract people up here? Regardless if it's essential, regardless if they say, whatever, how do we attract people up here? That's something that we can ask the board at some point. It's a great place to live. I love it up here. So how do we attract people to come here, and then how do we get them to stay? Someone had mentioned we need a shopping mall, and I agree, to keep the wives here, because the husband they have the outdoors. But, again, what can we do as a community to keep physicians here? Mary's laughing at me. Is everyone Is everyone aware of the mandates under the healthcare reform regarding insurance? Is anyone not aware? No, maybe.
Not in detail. But
Not in
big
detail.
picture, yes.
This will affect the falls. Obviously, I'm assuming on both sides, we have more than 50 employees. Is it safe to say? Okay. Under the Affordable Care Act, which is Obamacare, beginning in January 1st of 2014, any employer that has more than 50 full-time employees, which is more than 120 hours a week, which is roughly 120 hours a month, which is roughly 30 hours a week, that organization has the duty to do one of two things. Elect to provide health insurance to each full-time employee or not. Well, obviously common sense, let's not provide insurance. Well, if they elect not to provide insurance for each full-time employee that they have, minus the first 30, that organization has to pay $2,000 per head. Doesn't sound like a lot, but take a look at like Walmart, Essentia, I don't know how many employees they have, but that's a lot of money. That's huge. So let's say you have 100 full-time employees, you don't offer insurance. Every year you're going to be looking at $2,000 times 70, because the first 30 they give you are free, I don't know why. So you're looking at $140,000 that you have to pay as a penalty because you don't provide insurance. Well, common sense, we're going to provide insurance, right? Easy. We have 100 employees. We're going to provide insurance. Has to be affordable. How do you define affordable? Does anyone want to take a stab at it? Is what's affordable to a doctor affordable to a housekeeper? No. Affordable under the Affordable Care Act says your premiums on a monthly basis will not exceed 9.5% of your household income. So if, for instance, you just work for me, I get to sit down and say, so, how many people are in your home? You got a wife? How much does she make? You got kids? I want to see their returns too. So in order for me to provide affordable insurance, it cannot exceed 9.5% of your household income. How that's easy to do that, I don't know yet. The recommendation is to literally do what this was, sit down and ask, but you can refuse. Also, it has to be based on, from a statistical standpoint, 60% actuarial value. All that means is 60% is something I would pay, you would cover the 40%. You know, the old 70, 30, 80, 20 plans. At a minimum, it has to be 60, 40. So again, each person, full-time employee, I would have to sit down and say, what do you make? I need to make sure it doesn't exceed this. Then it's affordable. Once I do that, if you say, well, I still don't want yours is not affordable, I'm going to go with we call it the mothership. It's the Health Insurance Exchange. It's open now, online. You can't buy anything. But if you Google Minnesota HIE, you'll be able to go to the website. And that's where you can purchase insurance from the government, not through an employer or TRICARE, which is government. So if I have 100 employees, and let's say all of them hate me, which most of them do, Mary, don't they? All of them go to the Health Insurance Exchange. Each employee that goes to that exchange, I now get fined $3,000 per employee per year because I failed as an employer to provide affordable insurance. So, the healthcare organization in the Falls, they're going to be faced with this. Regardless if it's local, regardless if it's Essentia, that part's going to happen. And you should be made aware of that and start asking questions. Well, what are you doing now to prepare for this? This is happening January 1st, 2014. That's when it all starts. And they look at this year's staffing patterns to be able to determine, are you large or are you small? Do you plan on providing coverage? Do you plan on not? Can you take the hit? It's a huge, huge hit. And don't think you guys get off easy too, because if you elect not to have insurance, you're going to be paying a bill of $95 per person in your family, or up to 1.5% of your household income every year thereafter, up to 2.5% starting in 2016. So it's not as easy as me just saying, listen, I can't afford to pay the fine. You really don't need insurance, so let's just don't tell anybody. You don't get it, and I won't give it, and we'll both be fine, because you'll get fined too. Any questions thus far about these horrible constraints that we should all be made aware of? I hate to be so negative, you know we do. Should I go on? It's 8:45. I feel bad because I could come another time. I don't know what's best for everybody. It's kind of late, but
We have the room till 9:30, as long as people are interested. What else were you planning to talk about?
Opportunities and ways to stay independent.
Thought so. Yeah, definitely like to hear that.
Both of those are N1 or... I can make the opportunities really fast. Okay, opportunities, just in general for healthcare. Expand services. I know we've done some, or the boards or hospital has done some of these market analysis. The problem is, Cooch County has historically decreasing population. So if we're going to expand services, we need to figure out what services. Who's going to benefit from them? If we're only going to the doctor 1.3 times a year, do we really need to expand services? But that is an opportunity for growth. Work with other providers. What relationship do we have, or what presence do we have in other facilities? And I've only been here for 2.5 years, so I've been to Bemidji, I've been to Duluth, I've been to Big Fork. You know, that's an opportunity for us to be able to network with others. Talk with those who have succeeded, and I know you have been doing that, which is a great thing. You know, look at the Mayo Clinic. Rural, and now it's huge, and it's brought in such a huge population. And when I came here, I think, well, why can't we do that? We're a destination point. We got Canada 15 miles away. We could have the greatest healthcare. And increased communication between the divides. And when I say divides, I mean just in general, of course. There's an author, his name is Patrick Lexiconi. He said that the number one prohibitor of effective change is trust. How can you talk to someone unless you trust them? How can you act on something unless you trust? Communication occurs when one person talks or is vulnerable. I'm standing before you today. I could be nervous as heck, and I'm hoping to God you guys don't boo me out of here because I'm right now vulnerable. But I'm hoping by the end of tonight you're going to trust me with what I said because I was vulnerable. And I hope I can build trust with you. It's the basic for any type of change in communication. And if we can do anything as a community, we could start with that. But communication starts with trust, and trust starts when one person of two parties can act in a vulnerable state. Really good book, by the way. Well, that was fast. All right, now last but not least is options to remain independent. Strategic plan. And this is for any organization, so it's free advice, so why not here in International Falls? I once heard an interesting concept about sustainability. Increase the current services that you have to a larger population base, or keep servicing the same population but increase your services. Does that make sense? You keep the exact same services that you have right now, but we're going to make our geographic span bigger. Increases revenue. Or just do the opposite. We're going to keep our sector here. We're not going to go out to these other cities, but man, we're going to include this service and this service and this service. That's one way to stay in business. Accept change. Anyone here have a problem accepting change? I know I do. I've worked in organizations that do. Change is inevitable. Everyone has to go through change. The problem is, half of us think this change is good and the other of us think it's bad. And that's where trust and communication comes from. We must be open to change. Things change, people change. I'm not talking about giving up your mission, your personal mission statement, why you're here tonight, why Jim created all of this, but in general, be ready for change. Some of the greatest organizations fail because the leaders of those organizations cannot accept productive change. If you are, and this is an old saying, I love it, if you are set in your ways, move out of the way for those who are ready to make a difference. There's a wonderful book from John Cotter. It literally reads like a child's book. It's called My Iceberg is Melting. It's about 6 or 7 penguins. And they realize their iceberg is melting. Have you read it? I see nodding here, I'm sorry. And they go through the steps of, oh my God, the iceberg is melting. Oh, we're going to die. What can we possibly do? And it's just like an organization, or possibly a board, or a healthcare, or an institute, where there's penguins who are ready to jump in the water and find a new home. And then there's others who go, no, we can't change. No, we have to do it the way we've always done it. I know we've all experienced this. And it's a really good read. But it really creates a tone for how to produce effective change. And the very first step is create a sense of urgency. And I don't know about you, but us being here this evening talking about this topic, I think we have the sense of urgency. And I think it's time now to move on to the next step. Regardless of where this community's healthcare is directed, I hope it is accomplished with the community's best interest first, communicated in a manner whereby people aren't afraid of effective change, and after we have all learned to trust one another. Thank you for your time.
Well, I certainly like to thank both our guest speakers. They're more charged up and energetic than I am at buying a bug, but that's a poor excuse.
I'm going to pass these up. It's effective change bookmarks.
Effective change bookmarks, a little swag from the party here today. One thing I would certainly say, the more I look into this, the more people I talk to about the kind of decisions we're facing here, I don't envy the board at all. As critical as I may be of the relative lack of community engagement, it is a tough decision, a tough nut to crack. You're not a little scared after listening to that talk about all the stuff that's coming our way, whether we like it or not, no matter what we do. You're not paying attention. It's a serious situation. I would like to hear if anyone has any thoughts or comments they'd like to, or questions they'd like to add, anything they'd like me to pursue as questions, or any information that you think you can pursue yourself to share with the public. Have a hearing.
I was wondering if you would like to call Virginia and see how they're doing with their Essentia takeover. That happened just within the last year or two, and their mayor had lots of concerns. He said that he'd be their worst nightmare if it didn't go well. I'd like to know how it's going.
Yeah, there's some information available in news coverage. I plan on speaking with people from Virginia, Deer River, Sandstone, Aurora, and other locations to the extent I have time. And really, some people have asked, how can you help me out? What you can do if you know who to talk to, who has an interesting perspective on those things. A little bit of feedback here. Or you're willing to some of those people yourself, that would be fantastic. Also, we may not always be able to get people to come up and speak with us here, but it'd be great if we had a little informal subcommittee of people from different perspectives here that could either by a teleconference or on a road trip go visit one of these other communities and speak with people of different perspectives that have been through this there, put that information together and share it with people, include people from the board. Yes, that was speaking with Virginia, among others. Any other comments or questions?
I'd like to thank the three of you for providing information and your energies and your knowledge base to the rest of us. I really appreciate your openness and your gift of time here. So it would be nice to see the board do some of that too.
Anybody else? Well, you're welcome to submit more questions to me or write your own letters to the editor or however you wish. If you didn't get a chance to sign, if you wish to receive information by email, and you haven't given me your address yet, there's a list here you can sign up for that with. And the blog that I have, RLMCPublic at blogspot.com is the website. Pretty sparse so far, but I plan on putting more information on there as time permits.
If we sign the survey with our email address, we need to fill out the form?
The survey? Yeah, it has an email address spot on it. Or you can simply take my email address.
Yeah, I already did it.
Okay, yeah, it'll be it.